The goal of this project is to determine when and where extra medical support is most needed in order to help alleviate flu season challenges in the U.S. So here, we introduce the problem in a way that's approachable to anyone with access to this presentation. We start by asking who cares about the flu? Well, every year more than 10 million people in the U.S. fall sick with the flu, putting a strain on hospitals and employers. On average, more than 40,000 people die from the flu every year in the U.S., but not everyone is equally affected. The truth is that over 90% of flu deaths in the U.S. occur with people aged 65 and older. Hospital staffing shortages during flu season can honestly be the difference between life or death. And so knowing the facts about flu season can help us allocate our limited medical staff when and where they're needed most. So let's answer the first big question. When does flu season begin? Our map shows two different factors on a moving timeline. States are shaded from blue to red, as you can see on the legend here, depending on whether or not deaths from the flu are increasing or decreasing. The smaller circles on each state become larger and move from white to red, depending on the increase or decrease in flu-like illnesses being reported. Now we're able to show a strong comparison of how flu season progresses between various states by using z-scores for standard deviation, and that's the numbers that you see on the legend here. What this does is it helps to normalize all the values so that flu season progression is just as clear to see in a low population state, like some of these middle states, as it is in a high population state, like California, Texas, New York, etc. Our timeline begins in the lowest month for flu activity, August. We can play it here so that we can see that the circles are getting larger and brighter red before the worst month for flu deaths, which happens in January. This demonstrates how an increase in flu-like illnesses being reported often precedes greater flu deaths. And as you can see, flu season often has regional differences depending on which part of the U.S. it's in. In some areas it starts sooner and stays longer, particularly in the colder areas, and in others it's much shorter, particularly in the drier western states. Now, our chart here at the bottom shows how flu season can be measured by several different factors: flu deaths, flu-like illnesses reported, percent positive of flu tests, and positive flu tests. We include both of these last two factors because some states perform less testing than others, so that percent positive can sometimes be a better indicator of increased flu activity than sheer number of flu lab tests. Regardless, each state has its own characteristics of its flu season, and that information can be used to provide targeted support. That's why if you click on any individual state in the dashboard, let's say for example Texas, then it will give you that state's specific flu season chart here below. We can use this information to compare specific states now, but we'll also come back to it later when determining how to allocate our medical resources. But just as an example now, you can see California. Its peak is in January. As far as its testing goes, all those peaks are also happening in January, except that flu-like illnesses for California are peaking in February. A state like Mississippi, they actually have a peak in flu-like illnesses reported before you have a peak in flu deaths. And for most states, that's the same. Now in this slide, I've also included several text boxes detailing these sort of conclusions, so that anyone with access to this slideshow, but without my presentation, can easily follow along. So our next question is, where? Where does flu hit the hardest? Where are additional medical resources needed the most? So in some ways, this is an easy question. Here on this map, you can see which states have the most flu deaths. It's very obvious. It's California, New York, a few darker red states like this. But that doesn't mean that they need the most additional help. Not necessarily. The obvious truth is that any state with higher populations is going to have higher numbers of deaths, from all causes, not just from the flu. Therefore, it can be helpful to look at what percentage of the most vulnerable populations are dying from the flu every year. And if we remember from our first slide, that those aged over 65 are by far the most vulnerable to the flu. So as we select this different measure here, we get a very different perspective on the problem of the flu. Here you can see just at a glance that California and New York obviously still suffer greater percentages of their vulnerable populations dying of the flu. But so many of these middle states in the southeast, a little bit further west, are also having disproportionately high numbers of their vulnerable populations dying from the flu, such that Tennessee is now the second most vulnerable state, even though its population doesn't compare at all with New York and California. But for Tennessee, 0.14% of all their people over age 65 die of the flu during flu season every year. New York is just barely higher than that at 0.15%. And so when considered in this way, California doesn't even make the top 10 list. Although surprisingly enough, Hawaii is actually ranked number 3, which is with its vulnerable populations being the most likely to die from the flu. Of course, you can see that down there. States with higher populations and higher numbers of flu deaths, but with lower percentages of flu deaths among its vulnerable populations, those states apparently have average or above average medical resources to handle their flu seasons, such that they're not disproportionately burdened by flu deaths, but instead they keep track in line with their overall population numbers. However, these lower population states, particularly around here, Arkansas, Missouri, Kansas, that have disproportionately high flu deaths, clearly they're not as well equipped to deal with their flu seasons, as flu in these places is much more likely to result in death of a member of the vulnerable population than it is in other states like Texas, which has a very high number of people, high number of population and of people in vulnerable populations, but a much lower percentage likelihood of dying of the flu. In this case, you can see it's just almost 0.09%. So again, I provided some helpful text boxes to those viewing this slideshow on their own. Now, of course, naturally, when we see this, we want to ask ourselves, why? Why is the flu worse in some states and not others? So here we have a group of charts that helps us consider that specific question. We've identified 4 different factors which we believe might contribute to some states being disproportionately vulnerable to the flu compared with other states. And these factors are vaccination rates, population density, urbanization percentage, and the percentage of their population which is 65 and older, and that's considered particularly vulnerable to the flu. So on this map, the blue color of the states will change with intensity depending on which factor we select, whereas the circles actually get smaller, like Wyoming here, or larger, like New York and Tennessee, depending on how vulnerable those states are to the flu, more or less than average. And of course, remember that our vulnerability is being measured by the percentage of their vulnerable populations which die from the flu each year. So all these circles and colors on the circles, these indicators remain the same regardless of which factor we choose. So they help us to maintain a reference so that we can remember which states are hit hardest by the flu. So the first factor we have selected is vaccination rates. This data comes from a survey of flu vaccination rates among children in each state, and is currently the best data that we have on this factor. Here we can see that there are a few areas that have concentrated lower vaccination rates and a few with higher. So this area tends to have lower vaccination rates. These areas tend to have higher, as well as the coast over here. These charts here at the bottom are dynamic because they show the top 10 states and bottom 10 states for each factor. These middle 2 charts show the same states, but instead of just showing their ranking on each factor, they show us their percentage of vulnerable populations that suffer from flu deaths. We've also averaged the vulnerable population of flu deaths for the top and bottom groups of each state for each factor, so that we can quickly and easily compare them to see how it might or might not correlate with each factor. The reason I've included these shorter lists, really, is so that it can be seen that none of these factors have a one-to-one correlation with vulnerability to flu deaths. Instead, they do have a complex relationship that accounts for some, more or less, increased vulnerability to flu. There are, of course, factors that we haven't identified here, such as climate and robustness of healthcare systems, etc. But if we look at what we have, we can see that the top 10 states with vaccination rates go between 60% vaccination to 70%. The bottom 10 are between 28% and 43%. And the likelihood of a member of the vulnerable population dying from the flu in one of these bottom 10 vaccination states is 0.089%, whereas in the high vaccination states it's only 0.059%. So we already see that being in a higher vaccination state makes you less likely to die from the flu. Let's take a look at population density. Here, it's not spread out so much. New England has the most, California has a bit, Florida has a bit. The top 10 with population density range from 282 to 1,000. That's a big range, whereas the bottom 10 range only from 6 to 35, much smaller. But we can actually see a much more marked difference in the likelihood of a member of the vulnerable population dying from the flu. For those with the least population density, they're only 0.041% likely to die from the flu in a given year, whereas those with the top population density are 0.08%, much higher. Let's take a look at urbanization percentage. Here, the differences aren't as big. We go from 95% to 88 in the top 10, 39 to 60 in the bottom 10. So there's not that many states with low urbanization percentages. And the difference in their likelihood of death is 0.072 and 0.080. Not a big difference. Now let's look at the percentage of the population that's 65 and older. That means how much of a greater proportion of our vulnerable population does a state have compared to states with lower proportions of vulnerable populations. Now on the map here, we can see that Florida actually has one of the highest states for vulnerable populations. Vermont actually has even more. Maine, West Virginia, etc. Whereas the bottom numbers of states with vulnerable populations are Utah, Texas, Georgia, etc. And the difference in their numbers is actually surprising. The states with the least amount of vulnerable population have the likelihood of 0.075% to die from flu, but the states with the most amount have 0.064. That's really not what we would expect. Contrary to what would seem logical, these states with higher proportions of vulnerable populations don't actually suffer higher numbers of flu deaths of those populations. And I actually did multiple statistical analyses in order to test these factors, and they consistently demonstrated that there is no relation between these two factors. Now, while we don't yet know the reason for this, it's clear that having higher portions of vulnerable populations does not have any direct correlation with a state being more susceptible to the flu. The two ones that have the highest, we've noticed, is population density and flu vaccination rates. One, population density, we can't really control at all. But the other, flu vaccination rates, we can potentially have some effect on. And so finally, the big question behind all of this data analysis is, what can we do about it? So as a medical staffing agency, how can our resources be used to best alleviate the challenges presented by flu season? And this here is the dashboard that's going to be most likely to be repeatedly referred to make those decisions. So here we can choose to view the top most vulnerable states to flu. And again, this is being measured by how likely the vulnerable populations are to die of the flu during any given year. We can choose 15 like it currently has. Maybe we have enough resources to help 30 states. And we can just make the list longer and look at each one. Maybe we can only do 10. But all that information is easy to populate here on the chart. Now as we select each state, let me go ahead and move this back to 15 because I just kind of like that. As we select each state, we can again analyze the specific characteristics of its flu season. Here we already have New York, but we could do Tennessee if we wanted. And not only that, but we can see what percentage of their non-vulnerable populations die of the flu. So in Tennessee, it's 0.14% of their vulnerable populations, whereas their non-vulnerable populations is only 0.003%, much less likely to die of the flu. Again, reinforcing that fact that we know that people aged 65 and older are the vulnerable populations. But since we can see all the different characteristics of their flu season, we can know when they're most likely to start needing additional support. So for example, in Tennessee, flu illnesses and stuff do have a big increase. They basically double between October and November, but they shoot up in December. So if we started sending extra resources towards the end of November, we'll be there just in time. The peak for their deaths is still in January, but actual peak for their flu-like illnesses being reported isn't until February. Whereas their positive flu lab tests peak in December, and for some reason, they continue to decrease after that. Again, as I said, each state has its own particular characteristics and the different measurements for flu season. And so having access to this information for each state helps us to have a better idea of when each of the most vulnerable states actually need the resources that we can try to provide. So not only that, but here, over on this side, we have a simple timeline that shows how each state's vulnerability to flu has changed over the years. So a lot of states, let's look at New York, let's look at Tennessee, a lot of them, their vulnerability hasn't changed much over the years. You mostly have a straight line here. But some states do actually have increasing vulnerability to the flu. In particular, Hawaii has been much more heavily impacted in recent years than it was in previous years. Now, we can't yet identify why that might be, but with this information, a state like Hawaii can be prioritized for extra additional support this year to see if we can help reverse this trend. In addition to knowing when and where to send our supplemental medical staff, we've also seen that increased flu vaccines can have a big impact on reducing a state's vulnerability to flu. So therefore, with the flu season timelines we have access to here, we can also decide that during the low months, when our staff are less urgently needed to directly support hospitals, we can instead send them to states with low vaccination rates, but higher vulnerability to flu, such as Arkansas. We can have them support community-wide flu vaccination drives during those months in order to try to prevent, or at least significantly decrease, many of the flu season problems that these states are having year over year. Now again, throughout this slideshow, there are some helpful text boxes on every slide that detail these conclusions for anyone who's interacting with this slideshow on their own. And then finally, for those interested, all of the data sources used for this project are accessible from here. And here we also detail which years this data was provided for. Each set of data had different years that we had access to it. And that is the end of my presentation on understanding and responding to flu season. I hope this has been enlightening and that it also provides an effective potential resource for limiting the damages that the flu causes to vulnerable states in the U.S. every year. Please let me know if you have any additional questions. Thank you.